Next, we are going to hear from Bob Pezzolesi about nutrition-related legislation. There's a little bit of a theme running through our coalition meeting agenda today, with some focus on where we can get some of the have the most impact in terms of legislation, etc. So, Bob, I think you are on. There you go.
Thank you, Charmaine.
Hi,
It's
Bob. Good to see you. Mm-hmm.
good to see you. Really great to be back with Bronx Health Reach, considering the just critical role Bronx Health Reach had in the Interfaith Public Health Network, including um, supporting a lot of the early work and really being the ground for the campaign to remove alcohol ads from the NTA system, which was one of the things that really inspired IPHN. May I share my screen? Can see that. I'll go into slideshow mode. Just one second. Okay, so we're looking here at a range of food policies. Charmaine tied things together. And we're really excited about this. And we're working with the Center for Science and Public Interest on this. And you may be familiar with CSPI. I know that they have presented here at BHR meetings where they're looking at the federal level to really help our food system be safer and healthier. They were the main force to get those nutrition facts labels on retail food that you've seen, and help to add the added sugar line to that as well. So we're really looking at four pieces of legislation here at the state level. And then there's a city piece of legislation we'll talk about in a minute, which looks like it's going to pass. So we're just waiting on that, but we'll add that too, and the possibility for state work on that. So the four pieces of legislation are the Predatory Marketing Prevention Act, uh, sodium warning label bill, which looks at taking the New York City successful policy of putting warning labels on restaurant foods that have more than a day's worth of sodium in them, and putting that statewide. The sweet truth added sugar warning labels, which we were able to help pass at the New York City Council level in 2023 with a lot of with sign-on and a lot of help from Bronx Health Reach and Bronx Health Reach partners. And we'll see that, by the way, in October of this year. It's going to roll out in New York City. And then something that there's been a lot of talk about federally and a lot of excitement about in New York, and that's the Food Safety and Chemical Disclosure Act. And I'll get into each of these specifically. The Predatory Marketing Prevention Act, sponsored by Senator Zellner Meyer, I know is a friend of the coalition, will help define and restrict predatory marketing of unhealthy food aimed at young people. I'm sure we're all familiar here with the deluge of false and misleading advertising sent at young people, particularly getting them to eat junk food, fast food, and sugary beverages, which disproportionately impacts children of color in neighborhoods in poverty. So this is definitely an issue of equity. NYU has done some great research on this, as well as other partners. More and more research is also showing that finding ways to restrict this advertising will help reduce diet-related disease among young people. With bipartisan support, so some Republicans actually voted for it last year as well. This year, it's already passed the Senate Agriculture Committee. um, is now in the Senate Consumer Protection Committee, and it is set for a vote. Uh, I believe it's this next Tuesday, and we think it'll have no problem. So typically, bills that pass the Senate can get through the Senate again, is our understanding. It got stuck in the Assembly last year, in the Assembly, the Ag Committee, and this year it's in Consumer Affairs and Protection. Um, so, we're hoping it'll have an easier time. And there was a wonderful op-ed in City and State publication, which is seen by a lot of electeds last week. And I recommend this if folks want to see it, and we can, share links with folks after this. Happy to send an email that you can send out to the coalition with all these links for folks that want to see this. But this was a great op-ed to talk, hearing from the electeds exactly why this is so important, especially for kids of color. The sodium bill, and mind you, both of these next bills don't really impact New York City as much, but I think it's still important for New York City electeds to support these because, they're also part of the statewide legislature, and we want to make sure that upstate communities have the same benefits that New York City communities do. So the first is, we know the New York City Health Department instituted these sodium warning labels. If you haven't seen them, look for them. For instance, if you go to Chipotle, you can go to a place that you may think, oh, this is healthier for me than eating at other fast food or quick service type restaurants or casual chains. But, as you can see, if you get a Chipotle, if you even get the salad, right, the healthiest option because there's greens on the bottom, and you even skip the cheese, which tends to have a lot of sodium, you can still get more than a day's worth, in one salad setting. So, and again, this is Karina's Reyes, who's been a champion for us on these issues, and Senator Gustavo Rivera. So you've got this strong, wonderful Bronx connection here. This has actually passed the Senate twice before. Strong support, and has passed the Health Committee this year. Again, the problem seems to be that things get stuck in the Assembly. Closely related, the added sugars warning labels. I'm sure you folks are familiar with the sugary beverages that kids are getting at Dunkin', Starbucks, other places, as well as, of course, soda. So frequently these drinks have more than a day's worth. So 50 grams of added sugar, 12 and a half teaspoons. And in some cases, like if you see this Dunkin' triple mocha, if you get a large, it's 159 grams. So that's over 45 teaspoons of sugar in one cup. And it's difficult to imagine how they could get that much sugar into one beverage, but they do. So this is something that there's research about the impact of sugar on young people especially, but all of us. So this, again, we were able to pass at the New York City level. The New York City Council passed it, and the mayor signed it, and the New York City Health Department worked to get the actual process and procedure done. And we're looking at this will be rolled out in October, and we'd again like to see the whole state. If New York City can do it, and the rest of the state can do it. And then the Food Safety and Chemical Disclosure Act. So this was actually two different bills last year, and they decided to put both bills together, and they're actively working it to get into the New York City, the New York State fiscal year 2026 budget. So, it wasn't in the governor's budget, but they wanted to get it in both of the one house legislative budgets. So this bill would do three things. The first thing it would do is it would ban three, which was banned at the federal level. CSPI had a lot to do with that. It took FDA 30 years to do that. By the way, when they first saw that it caused cancer, And they banned it from cosmetics, but they still allowed us to eat it. And then also propylparabens and potassium bromate. So even though the FDA did ban red dye number 3, this bill would ban it sooner, and it would also keep New Yorkers safe in case something happens at the federal level where that's reversed. The second thing is it would remove artificial food dyes from New York State public foods. These are already not allowed in New York City public schools. New York City hasn't allowed these for several years as an administrative decision, and they were recently banned in public schools in California. And we know from really good research that these dyes can cause neurobehavioral problems in some children. So we shouldn't be serving them in school meals. And then finally, this is the hardest part of the bill to explain, but it may be the most exciting and impactful. Basically, our federal system of looking at chemicals before they get into food is broken. And it was broken even before the Trump administration came into power, quite frankly, where basically, to put it simply, chemical companies, food companies can self-certify a chemical is safe. They can say it's safe, and it can go in, and for lots of different reasons, the FDA doesn't stop them. So what this bill would do is it would set up a database that would be maintained by the New York State Department of Agriculture and Markets. And if there's a chemical in food where they've used this particular loophole, they would have to list it. We wouldn't stop them from using it at the New York State level, at least with this bill, but there would have to be transparency. And what this bill would do is it would allow New Yorkers to know some of the chemicals that are in their food. These companies would have to say why they believe, they'd have to provide at least basic research as to why they believe it's safe. So that would be for the public. But it would also could be used by folks in other states. This would be a public database. So it would be known what these chemicals are. And again, there's a lot of chemicals where we really don't know if they're safe. Europe has a much better process generally of handling these, where it has to be proven safe before it goes into the system. And we unfortunately tend to have a system where there's a problem and we're figuring after the fact what we should do about it. I mentioned the New York City bill. So at the New York City Council level, INT 641, sponsored by Bronx Council member Kevin Riley, with strong support from Health Chair Lynn Schulman and 38 of their colleagues. So we have 40 of the 51 members of the New York City Council have signed on in support. It's gone through committee. And basically what this bill would be is if a restaurant offers a kid's meal, they'd have to offer in the current language of the bill at least 2 meals that meet certain nutritional standards. So caps on things like sodium, added sugars, and bad fats, and also the presence of some healthy things, fruits, vegetables, whole grains, etc. And then there's some other details in it. And if you want to read that and get to know what those specific details are, this is being led by the American Heart Association with CSPI, and they've worked nationally at coming up with some of these standards. Just to say that the bill will likely pass this year. We're waiting because there's some negotiation with the health department in terms of getting this bill to where they think it's at its strongest. And so there could be some changes made, but we're really excited to see that happen. And if it does, we're talking to community members to see if there's interest in a statewide version of this. Again, New York City does it, shows that it's workable. It could go, across the state. And this is a bill that Senator Rivera has had in the past. We haven't seen one yet this year. And the last version of it, there wasn't an assembly version of it. But again, if it's good for the people of New York City, state folks as well. So some practical ways folks can help. So for healthier kids and families. Encourage your senator and assembly member to co-sponsor or support, or if they already do, thank them, and we can share, folks. And it's especially helpful if they sit on these relevant committees, right? So agriculture, consumer affairs and protection, education, and health, depending on what the bills are. Um, Also, at the individual level, for the Food Safety and Chemical Disclosure Act, there's an action alert that CSPI puts out. So you just put in your information and it automatically sends it to your legislature. And Senator Brian Kavanaugh, the sponsor in the Senate, has also started a change.org petition at the individual level. For organizations, we have a organizational sign-on support form. Again, this is one of the things we used, for our campaign to remove alcohol ads from the MTA, and we've used it for other campaigns in the Sweet Truth campaign. And it's just good to get a really big list of diverse and engaged organizations to say we care about this and our people care about this. So we'll have a form where you can sign on all the campaigns at once. But you can also pick and choose if you'd like, if there's some campaigns you prefer over others. Um, Also, we've got a great communications team that we're working with CSPI. If you have a story that you want to share about any of these issues and how it's impacted you and your family, we have a Google form where you can talk about that and we can share with our communications folks. They're really interested in hearing how this is impacting people at the community level.